most important question that we can ask ourselves is why? Why Northeast Delta Human Services Authority?
I'm Jennifer Purvis. I am the Director for Developmental Disability Services at Northeast Delta.
Dr. Martha Phillips.
Dolores R. Harris.
Dr. Avius Carroll, Director of Prevention and Wellness.
My first day was with the agency. We were in a small building, and I had to clean out the closet, supply closet. And I said, oh, it's gonna be a big room. It was just a regular closet like at the house.
When we became an LGE, I was a contract employee working on coalitions. I was hired to build coalitions to address underage drinking and prescription pill use.
Local governing entity, which was bringing about behavioral health services, addictive disorders, and the Office for Citizens with Developmental Disabilities all under one umbrella, in which we could collaborate and collectively support and serve the region of Northeast Louisiana.
The overall impression was, you know what, if we can really make this happen, we're going to heal our communities. We're going to heal our mental health communities, our psychiatric communities, because there are now resources that are available to them. There are things that they can actually be involved in that will optimize and maximize their health and recovery.
For 10 years, Northeast Delta Human Services Authority has been operating in facilities and clinics just like this. Here in Monroe, Louisiana, our largest clinic, we also have general pharmacy. General pharmacy can mail out pharmacy prescriptions anywhere in our 12 parish region, as well as organize the pills that best suits our vulnerable populations as they consume. Safety, convenience, quality, competent care at its best.
I really enjoy being here at General Pharmacy. It gives me the freedom to take care of the patients in the way that I feel is best. And also they give me the abilities to give the personal touch without the rushing of the patient. Come by and see us, and let's see if we can be the pharmacy for you.
We will be able to offer primary health and mental health services off of the mobile unit. Some of the primary health services we're going to be able to offer will be basic vision screening, vital signs assessments. We will offer laboratory services and primary care visits. We will offer mental health services. Those can be brief screenings or screenings for further treatment. And we'll also be able to offer telehealth services that you'll be able to see a mental health provider.
Part of the vision and mission of this agency, Northeast Delta Human Services Authority, is to provide that quality care, that care with compassion, with understanding, and being able to truly identify with clients who are in need of mental health services and health care, and to meet them not only at their place of needs, but beyond their places of need.
We look at the data consistently from the beginning when Dr. Sizer was here until now. I mean, he's even built a data analytics department to truly allow the data to speak to us and to show us, to guide us into what programs we need to continue to build, what programs aren't working, where we need to put more funding to build on what's really being used. And so we've also seen an increase in the number of people that we're serving across the board, across our programs.
One of the ways that we connect is to demonstrate that we understand.
It's an American issue, and until we are able to grapple and deal with the realities that we are in this together, we will never be able to properly mitigate it.
Dad, I know things are hard for you right now.
I can feel your energy is gone.
I see you retreating into yourself.
But I want to ask you to stay.
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 My world
is better
with you in it.
With you in it.
If you're worried about a loved one and don't know what to say, start with stay. For more, call or visit our website.
This last decade has been devastating. First opioids, then heroin, and now fentanyl.
These are the ODs that came in just this week. Fentanyl, fentanyl, fentanyl. They're all fentanyl.
My son.
My grandson.
My big brother.
My best friend.
Fentanyl is forever.
You made the best out of what you had, and that you loved and cared for those that came across your path. And you were not concerned about whether they were male or female, about whether they were white or black. All you were concerned about is whether or not you could lend a helping hand and help and make the world a better place.
Using your faith to reduce fear. We know that in our community, in our country, there are so many things that are out there that's not looking too good, and it can cause us to have a whole lot of fear. But we want to make sure that you are encouraged, you are inspired, you have resources, you have all the things that you need to overcome fear.
DJ Twin! Let's go, let's go, let's go!
I've had several fond moments, but I think maybe my most fondest moment was one of our employee appreciation gatherings where we were able to recognize our staff and show the appreciation for the works that they do in Northeast Louisiana. To be able to bring our staff together, you know, we were off-site and we were able to just come together and just kind of take a load off and just share a lot of the experiences that we have in our day-to-day operations and the things that we do in the community. We were able to just come together and share and from an administrative point, show the employees just how much they are appreciated for the things that they do in our agencies and in the clinics.
So much has happened in 10 years. What I learned about the agency and what I learned about the people of the agency is that they really care about what they do. Being here 10 years, you have no choice but to grow. I mean, the agency grew, so you're forced to grow with it. And one of the other things, so I can say that I've experienced a level of maturity that I've been able to identify and trace over the past 10 years. And I've also made some extremely good friends, people who aren't even here anymore that I still keep in contact with. I think that over the 10 years, just because we were an LGE, we were very new and we were still figuring out a lot of things, that we had to come together. We built a really good camaraderie because we were all trying to figure out, okay, how do we do this? How do we do that? What does this mean, you know, to the general public, and what does it mean to us? And so that gave us a sense of family. And so there are people that I've started out with that are not here anymore, but I still communicate with them. So I built a lot of great friendships here as well. So I can't appreciate, you know, over the past 10 years being able to say that if I had to leave today, I believe that I have had an exceptional 10 years here and I have made some really good connections and some really good friends.
You can never be what you can't imagine. So for us, we have to imagine and reimagine what our region can be. It doesn't matter where you currently find yourselves. What only matters is how you end. Like that phoenix, we can rise together. Like that phoenix, we may get knocked down, but when we get knocked down, we must lift our heads and rise. Like that phoenix in its ashes, we must dust off We must believe, and we must make attempts together. Because if we do it together, if we believe in what we are about, and we are reciprocally interconnected and do what's necessary and required, there's nothing that can hold our patients and clients back, and there's nothing that will hold our region back. Because I believe, like the phoenix, we may be down, but we will rise.